Hello, I am so happy to welcome here to my channel Dr. Kevin Stock. Kevin, I have been such a fan of yours for so long, and I had the pleasure of meeting you last year at KetoCon in Austin, Texas, and I hope to see you again there next year. I just really thought about this topic for us because I was so impressed with your presentation that you do, and I'll show that as we get through these slides. But it is so impactful to really think about the fact that both for our eyes, our ocular health, our visual health, our oral health, our oral microbiome, for these two specific entities that we specialize in, there are such clear indications as to what is going on in the rest of our body. So I thought that would be a really great way to have a discussion. But if you wouldn't mind giving a little introduction as to, basically, I know you have a sleep apnea center or sleep disorder dental practice. So if you could just give a little update on that.
Sure. Well, first, Lisa, it's such a pleasure to talk with you. It's great meeting you in person finally at KetoCon. I wore the shirt to remember the occasion. This is the KetoCon shirt.
Yeah, it was great.
Yeah, it was an absolute pleasure to meet you. Thank you for having me on, and happy to talk about oral health and how it relates to nutrition, because I think there's you almost can't talk about oral health without talking about nutrition, but most dentists don't talk about it at all. So I think it's important stuff to talk about.
Same with eye doctors, really. I mean, I feel like I'm an odd man out here bringing up this root cause stuff instead of surgeries and drops and you name it, right?
That's right. So with regard to your question, to make a very long story short, I graduated dental school, and the one area of dentistry that really grabbed me, besides, like, I was already fascinated with nutrition for a very long time. That goes back to probably junior high. Most of my adult life, I've been kind of a nutrition nerd. But when I graduated dental school, the one area of dentistry that actually interested me, I wasn't very much interested in doing fillings and root canals and extractions and things like that. But there's this niche area of dentistry called dental sleep medicine. It's where dentists can get some advanced training and treat sleep disordered breathing. And sleep disordered breathing, we can go into the details of what that is, but it's basically your airways collapsing at night. And this ranges from upper airway resistance syndrome, which is basically snoring, to obstructive sleep apnea, severe obstructive sleep apnea, where literally the airway is being shut off when you're sleeping. So you're not breathing, and then the body's not going to try not to let you suffocate. So it'll wake you up. It'll basically, your body will do basically an adrenaline shot to wake you up, release all these stress hormones to open up the airway. And this goes on all night long, every night, night after night, day after day, decade after decade. So I would treat patients sleep apnea with these oral devices, and I very much enjoy that. This niche area of dentistry. For one, someone that has sleep apnea, they go 5 to 10 years without a diagnosis generally, and so they get their first real night of sleep in a decade, and they see the results like that. Like, they feel like a new person. So it's a rewarding area of dentistry and medicine as well, treating sleep disorder breathing. So that's a little bit backstory about that.
Great. And so what I'd like to do, because I really want to bring up the snoring and the sleep apnea too, and we're going to get to that. But the one thing, if you could kind of go over this here with this dental evidence that other species don't have mouths with crooked, crowded, impacted teeth, fillings, embedded, inflamed gingivitis, fatty tongue, and narrow airways that is causing, you don't see a chipmunk snoring or a rabbit or any species. So if you could maybe add a little to that.
Yeah, besides basically the dogs that we domesticate.
Exactly.
So, right. Excuse me, I just took up the funny breath.
I think I have an airway device for that.
Right. So, and these things are all related. Cavities, periodontal disease, fatty tongue is what I call it. They're all diet-related diseases that manifest in the mouth. And they are so common that we tend to think they're normal. For example, it's very much the norm for kids. I do pediatric dentistry as well. For kids to have cavities, so normal that it's just another, like, you go to the dentist, oh, you got cavities, we do some fillings, etc., and you go on. And I think something that we're going to probably talk about here today is like how like I like to say, it's the canary in the coal mine often, where if your teeth are rotting, literally the hardest substance in your body, tooth enamel, is being rotten away because of what you're eating. I think it's a pretty good indication that what you're eating is not appropriate. And so it often is the canary in the coal mine, which is this early warning system that can tell us when our diet is off. And dentists, I think they have some that we get some of the earliest warning signs that are often ignored, because I'll see a kid with cavities and they're 6 years old, where, they go to the pediatrician gives them a clean bill of health. They're like, you're yay tall, you're developing more or less fine, you don't have any diseases. Okay, you're fine. But the mouth tells a different story. And often those problems that I see in the mouth will later manifest as diabetes, obesity, metabolic syndrome, and the sequela of negative impacts that relate from that, like obstructive sleep apnea as well.
Yeah, I'd have to say, like, I'm sure you've never seen a mouth full of oral dishealth and have it be attached to a healthy person. Just doesn't
Exactly.
happen. So likewise here with the ocular evidence that I was presenting here, other species are not going blind from eye diseases. There's, aside from maybe trauma or injury, you don't have blind squirrels. And without the ability to see, we really lose the ability to hunt for food, and ultimately you'd starve or go extinct. So, it's another reason to believe our ancestral diet is really what is here to keep us to evolve and be healthy. So here I have on the top the the lovely, beautiful, healthy mouth, and then below what goes on with gingivitis, crooked teeth, that we can see how how disordered this mouth is. And then I have a picture here of a healthy eye, and right below it, the cataract that has formed, where somebody really can't see through that. And then the healthy retina up on top, and then below, this is a sign of all sorts of, diabetic retinopathy, hypertensive retinopathy, all sorts of retinal vein occlusions. There's so many disorders that stem from our health, our general health. So again, this is sort of a similar situation where I don't see anybody with eyes looking like that have a healthy body attached to them. And with cataracts being the leading cause of blindness, and everybody says, well, it's just a disease of being old. Well, guess what? Look at some of these statistics. Look how the prevalence of cataracts is increasing 129% from 1990 to 2019. So in about 30 years. And in China, the increase was even as high as 223%. This is not an increase in elderly people. This is a change in our diets. And, the increase in cataracts cannot be attributed just to the general trend of getting old. So here we go, Kevin. I've got this. I love this graphic I made because I love your canary in the coal mine part of your meat mouth presentation. So here, the mouth is the canary in the coal mine. It's the early warning sign when your diet is off. So any of you have bleeding gums, a diagnosis of gingivitis, in need of root canals, and we'll talk about that too, because that's something I know somebody has already asked about in the comments. And thank you all to those who are here now joining us live. But like in my profession, 9 out of 10 dentists in your profession are trying to just patch this and really smash the fires that are smoldering in their mouth, right? And they recommend all these elaborate rinses, washes, flosses, crowns, extractions, canal, all of this stuff, prosthetics. And it's basically just how I feel it is with eyes. You're masking it and it's not getting to the root cause.
Yeah, absolutely. And I find so much of this so interesting. My brother's actually an ophthalmologist, and we talk about a lot of this stuff. I think myopia is fascinating because if you think like it from an ancestral perspective, you have myopia, you're yeah, you're gone. You are not. You're going to be.
You're the man
selection.
inside doing the cave painting at 10 inches in front of your face.
Natural selection is going to move you right off the face of the planet.
Darwinian.
Exactly. And I actually read some interesting research not too long ago. It was a CE course I was taking, and they were saying the two healthcare professionals that are most likely to catch diabetes early are dentists and eye doctors. And I'm like, oh, interesting. So like when we're talking about the canary in the coal mine, here we are. How do we
Exactly.
where do problems first manifest, and can we catch them early? And I think, definitely the mouth is one of these canary in the coal mines, especially with cavities, but periodontal disease is a big one. So 47% of US adults in the United States have periodontal disease. And periodontal disease is gum disease where the bone that holds your teeth in is being eaten away. So it's a chronic disease that is like, it's pretty, like, when you put it like that, people are a little startled. They're like, oh, bacteria are eating away at the bone that are holding my teeth in. And nearly 50% of people adults in the United States have it. And there is a mountain of research that connects periodontal disease with almost every single chronic disease you can think of. And so much so, the associations are so strong that people would thought that the periodontal disease was causing these other diseases. Now, I think it might play a role in exacerbating some of these things. I just think they're more likely that we have a common root cause of mainly like a poor diet that is both leading to periodontal disease and this, myriad of other chronic diseases.
Yeah. And I had to do the same for the eyes with the canary in the coal mine, is that there is warning signs that I see in the eyes. Every patient that sits there, when I find different things going on inside the eye, it's an indication. And like in your profession, 9 out of 10 eye doctors are just trying to patch the symptoms because, the general trend is to recommend the eye drops, the AREDS formula, vitamins, injections, ointments, surgeries, and it's ultimately poor diet, and it's not being talked about, which is so really, really frustrating.
Yep.
So, and we can get into here, the key for root cause prevention really ultimately comes down to limiting the carbs, limiting the refined grains and sugars, and those dang nasty toxic poisonous seed oils, which are, have such a long half-life that you eat a French fry today, it'll still be there 4 years. It's that serious, and it's just a very slow suicide. And people don't know. I mean, we know, but we're in this space. But it's really so important that we talk about this, and in our professions, talk about it with our patients. So here is, I don't know, are you still providing that people can watch this presentation? So,
Yep.
Okay, so I'll be able to put a link in the notes because it's such a great presentation. It's here what your teeth say you should eat. And I just recently was reading one of your, I guess it might have been an Instagram post where you're talking about, oh no, it was your awesome, I think it was your Daily Bites. I don't know, it's a Saturday 7 or the Daily Bites. I love all your newsletters, but it was talking about the zinc isotopes in the tooth. Was it the enamel or the dent, and also the calculus is mineralized, so it really stays in fossil stages, right?
Yeah, and we can actually use all three of those to date teeth, and so it's super interesting. And for that presentation, the keto kind of presentation, they said, okay, you had 30 minutes and leave 10 minutes for Q&A. So I remember I was putting the presentation together, and my round one, I was like, all right, I'm going to practice it. It's like 2.5 hours long. So I had to cut so much stuff. And some of the stuff you're just talking about was some of the stuff I had to cut out, especially certain things I found so fascinating. I am fascinated by archaeology and anthropology and the fossil record. And one of the fascinating things is the dental calculus. That's the stuff that the hygienist goes in scraping off your teeth, because that preserves in the fossil record. And it basically acts as a snapshot of your microbiome, like the bacteria in your mouth, in time. And there's fascinating research done that was showing the changes in dental calculus, basically the bacteria in the dental calculus, at 3 unique times in history. One was like, okay, this was hunter-gatherer calculus, and it was more or less, we'll just call it a balanced microbiome. And then with the agricultural revolution, what they saw was the rise of karyogenic strands of bacteria in the calculus, mainly strep mutans. And then so there was a major shift there. And then there was another major shift that happened around the Industrial Revolution, where these karyogenic strands of bacteria became basically predominant. And so it's so fascinating to see how those major dietary changes we can see in the fossil record in the dental calculus, which tells us what was going on with the bacteria in the mouth during those transitions.
Yeah, it's so fascinating. It really is. So, all right. So here, this is so impactful looking at this. Can you kind of explain what's going on here?
Yeah, so I think a lot of similarities here with the eyes and the teeth is a lot of people think it's just genetics, right? And they just pawn everything off to genetics. I got crooked teeth, it's genetics. I got sleep apnea, it's genetics. I got cavities, it's genetics. I got passed on from my parents. And genetics play a role in everything, obviously. Epigenetics play a significant role in things as well. But here, so the first kind of picture at the top left is a skeleton. It's a good example. It's an older skeleton and no cavities. All 32 teeth fit in. They came in straight. No abscesses, no impactions. And this was the norm prior to the agricultural revolution. And it would be a strange natural selection phenomenon to select for teeth that are crooked or that are easily rotting.
Or or totally missing.
Yeah, exactly. So that's generally not how evolution natural selection works. So if we're looking at archaeology, it doesn't make a lot of sense. So a lot of this is not genetics, especially crooked teeth, especially cavities, periodontal disease, and our shrinking airways, so obstructive sleep apnea and such. And one of these pictures, the bottom middle one. So there's stories that go with all these pictures, but the bottom middle one is from Dr. Weston A. Price, who are people not familiar with. He was a dentist in the earlier 20th century, traveled the world at a unique time in history where we had airplanes, we had the photography, and we had the intersection of traditional indigenous diets and the modernization of diets, notably lots of refined grains and sugars. And so he traveled the world and he basically studied populations right next to each other. One population eating a traditional diet, another population with modern food. The modern food, the displacing foods of modern commerce is what he called them. And he documented all of his findings, like a tremendous amount of observational research. In his seminal book, it's called Nutrition and Physical Degeneration. Highly recommend it. It is a long book, kind of repetitive, but it basically found the same thing across the world. And that is those people that were eating mostly their traditional diet, they overall had healthy mouths and healthy bodies. And when the displacing foods of modern commerce came in, they rapidly got cavities. The first generation got cavities right away. Second generation not only got cavities, but they also developed malocclusion. So, I mean, the theory of like, it's just genetics. Dr. Weston Price did a lot to kind of disprove that theory all by himself.
Goes right out the window. So, yeah. And then here you have the shrinking palate. So many kids have to wear palate expanders, and
yes,
their teeth don't fit in their mouth, right? And then the ever prominent cavities also.
Yeah, and when it comes to malocclusion like this with a vaulted palate, and I see this, it's almost the norm now, unfortunately. It is multifactorial, like causes are multifactorial, but I think there's actually a root cause in diet, and it is really two things. I talk about growing your face is kind of like growing a muscle. If you want to grow a muscle, you need proper nutrition and you also need the proper stresses of that muscle. If you just eat well, but you don't move the muscle at all, it's not going to grow as it should. If you move the muscle, but you don't have the right nutrition, it also is not going to optimally develop. And so our faces, notably the maxilla and the mandible, the maxilla is the top jaw, the mandible is the bottom jaw. And many people, myself included, are underdeveloped. And a root cause issue of that is malnutrition, meaning we're not eating enough meat mostly, and we're also not chewing enough. So we're not chewing enough meat. Breastfeeding versus bottle feeding also plays a big role in this. And because of various dynamics in play here, it often will lead to mouth breathing, which will exacerbate the whole issue. So I think there's a root cause in diet that we see then in mouth breathing, we see in poor oral posture, and it just exacerbates everything. Starts to create long face syndrome. Kind of, I see it when I look in the mirror, unfortunately, where we have long, narrow faces. Typically, often we'll see a receding chin, although sometimes it'll look like it's more class 3, which is not to get into all the dynamics of it, but further out. Also, like receding maxillas and such. But yeah, all this leads to a shrinking mouth, malocclusion, and smaller airways.
You know, it's interesting looking that picture right there with the soft palate. That child clearly can't lay the tongue up onto
Exactly.
that palate like they're supposed to. So over in the live chat, interesting question from Christina saying, curious how diet actually makes the teeth crooked.
So I would say how diet makes the teeth. It's actually an inadequate diet will lead to crooked teeth. It's not that the diet will make
Cause it.
yeah,
Right.
cause the tooth to like you're eating something and so then teeth start coming in crooked. No, it's mostly for like so we have the top jaw and the bottom jaw, and we need them to basically fully develop. And if they don't, we have 32 teeth that are trying to come in, but there's not enough room for them all to come in. So they start just coming in wherever they can, and that's what leads to crooked teeth in a majority of the cases.
Yeah. And I have Dr. Mark Hirsch over in the comments. Thank you for joining in. And he says, love hearing you talk about the teeth and eyes. Wish I had a clue about this when I was practicing family medicine. He's a retired physician. I never made diet suggestions. Yeah. And the issue really is, you know, you're not taught that in med school, right? I mean, that's a big part of the issue. So, but yeah, now we all should be educating ourselves and really practicing root cause medicine. All
I feel like a
right.
lot of healthcare providers, we're not in the preventative business. It
Right. The
is like
sick care business.
I'll
That's
talk to my
really,
brother. I mean, he's an ophthalmologist. He's doing eye surgeries. He's doing cataract surgeries. He's not. They're not talking about diet. Like it's at the point where, like, where I was talking about, most dentists are trained. Like, hey, we're trying to put out the fires. Like the fire's already here, and we have to put out the fire. And they're not talking about how to prevent the fire. And that's where I've always been most interested in. Actually, is prevention. And to me, the number one step of prevention is education. So kind of like what we're doing here, and this is what I'm most passionate about.
yeah. So the comment over here is saying, so poor diet doesn't give us the needed nutrients to properly develop our jaws, then the teeth don't fit. Yes, that's really exactly really the mechanism. So
Yeah.
let's go on. Go ahead.
I was just going to say, if she's more interested in the mechanisms behind that, I do talk a little bit about that in the presentation as well. Vitamin K2 is a perfect example that you're mostly going to get in animal food that plays a vital role in the development of the jaws during development.
Yeah, great. Because somebody else was in here saying, my 8-year-old lost a tooth today. Does he have any tips for raising kids? I'm sure lots of beef and eggs, and she tries her best.
I do. So I do pediatric dentistry part time. I'm around kids all the time. My brother that I keep talking about, the ophthalmologist, he has 6 kids. I'm around little kids all the time. I some of my maybe my number one tip is this: being around kids. From a child health perspective, I would have the main course be meat mostly, and you eat that first. Okay. And then as long as we get that down, you are ahead of 99% of people. The second thing I would talk about is for parents, mental state is all the kids I'm around is all they talk about is snacks. When's the next snack? When's this? When this? And it leads to behavior issues and conversations like they don't want to eat the rest of their dinner because they know the sugar's coming after it.
Because
XYZ.
the snacks are Rice Krispie treats and
It's
granola bars, and it's just junk. It's just processed
it's
junk.
junk. And so I would rein in rules and expectations around eating those kinds of foods. Just like set a line in the sand and be like, all right, if we're gonna have desserts, we have it on this day at this time and these foods. So it's not just a constant battle. So kind
And
of the two things.
it could be something as delicious as you can take ricotta cheese or cottage cheese and put a scoop of Equip chocolate protein or Equip strawberry protein, which is amazing. It's like a lot of protein in a scoop, a tiny bit of stevia, and the flavoring of vanilla. They have salted caramel, they have chocolate. But just take an immersion blender and whip that and throw it in little custard containers. And it really is like a very nutritious, healthy dessert.
Mhm. One of my favorite kind of frameworks of thinking about childhood nutrition is children have immense growth demands, but they don't eat immense amounts of food yet. So they need to make every bite count. And I think if parents have that in mind, they're like, okay, we need to get the most nutrient dense food into your belly first. So that's mostly going to be the red meat. It's going to be eggs. It could be some dairy, but it's going to be like animal products. You could throw some other plant products in there too on top of that. But I would focus on getting that nutrient dense food in first, because they do have immense growth demands and they don't eat as much food as adults. So you got to make every bite count.
Yeah. So we could go on to now. This is a really huge topic with snoring and sleep apnea. But here I put, was ancestral man suffering with sleep apnea? Can you imagine the snoring in the cave? And really, in regards to obesity and fatty tongue being such a causative factor.
Yeah, and I do like to defer to ancestral diets, especially when it comes to oral health, because if we could look back and be like, okay, our ancestors, they weren't getting cavities and they had these big, wide open airways, which means they likely were not snoring and they didn't have sleep apnea. We really should take clues from that if we can. And I know there's some people that don't like to take a ancestral perspective for everything, but I do think using that as one frame of reference to look through is important. And if you can imagine like snoring back in the day, especially like if we go way back, like pre-agricultural revolution, like it's going to signal to, wild animals, come get
Here I am.
like, that's not
meat.
yeah, exactly, that's not the warning sign you want to send out.
Yeah. And so I have people asking me, because I have brought up this, your patented device, but I think you're in production change because it's not available right now. I have two people that are really, really waiting for this. So
Yeah, sure. So a little bit, I guess, 2 seconds on the backstory is I started the private practice exclusively dedicated to treating sleep disorder breathing and with oral devices. And like I was talking about, the oral devices work that they'll move the bottom jaw, the mandible slightly forward to open up the airway. Like if someone's ever learned CPR, they'll tell you to like lift the chin because that opens the airway when you do that. And these oral devices can be great for some people, but there's limitations. I'm not going to go into all the limitations right now. It'll take us an hour. But I kind of always had like this perfectionist kind of mentality. And so I would treat someone's sleep apnea. Let's just say they had severe sleep apnea. They had an AHI of 30. And I give them an oral device and we get that AHI. And the AHI is a measure of severity. We can go into what that means if people are interested. But let's say I get that severity down to mild, 10. That's 10 events an hour. That's great, right? We took them from severe to mild. But in my mind, it was always like, that's not good enough. Like they're still having airway disruption 10 times every single hour of every night. So if it's for 8 hours, that's at least 80 sleep interruptions. Like that is not very good. Better than 30, but not very good. So anyways, I went down a deep rabbit hole to be like, how can I better treat all my patients? And the rabbit hole led to this technology known as EPAP, which is expiratory positive air pressure. Again, probably not to get into all the technology of how this works unless people are actually interested in it. I dove into EPAP, and there's limitations of EPAP. Go figure. And so I was like, okay, I want to use EPAP, but I also need a nasal dilator because I need to facilitate nasal breathing. And turns out nothing like that existed. And so I went developing it. We got the patent for it in 2020. The last couple of years, we've basically been prototyping it, iterating it, making it better and better and better. And right now we are moving to like final kind of mass production. So it's been quite the journey. I'm excited to get this really more mass-produced product out because anyone that's been on the website will see it. It's been sold out for the majority of its existence, and then we'll make some, and then I'll get them sold. And anyways, we're going to overcome that problem here shortly.
yeah, that'll be great. And if there's anything that I can link people to in the notes, you'll let me know so that I can have that up, because here is basically that EPAP and showing, and then the statistics about how much of an improvement with people who have mild to moderate sleep disorders, right?
Yeah, and so EPAP, I did not invent EPAP. I would say the primary technology that it uses, unfortunately, EPAP's been around for about. The first EPAP product came out in 2004 for sleep apnea, but it's undergone a decent amount of research to show EPAP is effective, safe and effective at treating both snoring and sleep apnea to various degrees. That part does work, and it works through a one-way valve. Basically, it provides positive pressure. If anyone's familiar with the CPAP, it's continuous positive air pressure. Well, EPAP is basically using your own exhalation breath to create a back pressure, more or less, basically to slow your exhalation and provide a proper breathing pattern to keep the airway open.
Yeah. So, and my final slide before we take some questions. We got a lot of great questions. Is my own personal thing here where I, at the age of 40, so before picture, I was a victim of crowded teeth my whole life, and finally had a dentist who mentioned, your jaw's going to continue to shrink as you age, and this is going to get worse and cause problems. Why don't you consider braces? And I said, all right, why don't we? And I am so glad I did, because, at the end game, it's like
They
there's
look
nothing
great.
better than having a great smile
They look
and
great.
great straight teeth. But I had a long history of sugar addiction, processed food addiction, binge eating disorder. So if anybody doesn't know my back history, I mean, I suffered for a long time and ate a lot of junk, so addicted to food, and so really happy to be out of that and be hopefully a person, both as an eye doctor and pretty much carnivore coaching that I do now, just really truly just trying to help every person I can with eating the optimal way, and realizing that there is a way to get out of the addiction, because it can be really, really severe.
Okay, and I always find it fascinating how, because my backstory, not to go into it, but like I had a terrible diet growing up, and I struggled with overweight issues as a young kid. But that's what catapulted me into, like, all right, I want to solve this problem, and of decades long experiments to try and figure out what is kind of the best diet for. Initially, it was like fitness. I just want to lose the fat and like feel good in my own skin. But then it had a turn for health, and so basically, finally putting health and fitness together, which has led to here we are. Meat-based diets, I think, is the answer to both of those things.
Yeah. All right. So let's pull a couple questions over. Roxanne says, what are your thoughts on mouth taping at night, and potentially not as good as the EPAP device?
So great question. I am a big advocate of mouth taping to train nasal breathing. Now, I always give a caveat here is if someone has some form of airway obstruction, like upper airway resistance syndrome, which is kind of like, just think of that as snoring, to sleep apnea, mouth tape can help improve to some degree, but it is not a recommended treatment option, especially for sleep apnea. Like mouth tape for sleep apnea, and you can't, like, if you get a diagnosis and a prescription, they will never prescribe mouth tape because it's not used to treat sleep apnea. I've never seen any research to really say, hey, this is an effective sleep apnea treatment. EPAP device, on the other hand, has been studied, and if you got a diagnosis and a prescription for sleep apnea and an EPAP device, you can use that to treat various levels of sleep apnea, like mild forms of sleep apnea. Just caveat, the device I developed is not a sleep apnea product. We are not making any medical claims. It is just an anti-snore device. So just want to put that caveat out there. So I'm a fan of mouth taping as long as it is not to mask an underlying problem of airway obstruction, because sometimes it can it can mask that problem. So if anyone has an airway obstruction, I would recommend uh,
Really
looking into that.
yeah, more full evaluation. All right. Monica says, I have receding gums. I use an electric toothbrush and water pick. Is the electric toothbrush doing more damage than helping?
No, I think electric toothbrush is the way to go. It actually helps remove a lot of what would be user manual error. As long as electric toothbrush, and most of them will have relatively soft bristles. The big cardinal mistake when it comes to brushing is like a hard bristled toothbrush very aggressively. That can lead to receding gums. Receding gums is a lot of times, well, it could have been from years and decades ago, but it can be from so many different factors. Malocclusion can lead to receding gums. Things like smoking, anything that's going to cause inflammation in the gums, notably diet as well. So smoking, diet, malocclusion. There's a long list of things that could potentially lead to receding gums. But an electric toothbrush, no, that is generally what I would recommend. The only caveat I would say is there are certain toothpaste that can be very abrasive. And so, for example, a lot of whitening toothpaste, they will have abrasive in it because that will help remove stain. But also it can be abrasive to the gums, and that abrasion to the gums and inflammation in the gums are what's going to lead to recession.
Yeah. And is there something to be said about remineralization toothpastes?
Yes. So really, there's two main remineralization toothpaste. One is fluoride as a remineralization agent, and the other is hydroxyapatite. Fluoride is a massive discussion. So I don't know if we want to go into that, but those two can help remineralize teeth. Both have pros and cons, meaning like the fluoride will help remineralize your teeth, but it can have a whole laundry list of potential cons. Hydroxyapatite, depending on the kind you use, can be as effective, but also have potential considerations. I'll say cons, like nanohydroxyapatite. These are nanoparticles, and they are very small. And most of the holistic biologic dentists are going to recommend nanohydroxyapatite. I think I would recommend that as well, but with caution, because I'm not fully sold on it's totally benign as some people will lead you to believe. There's another form of hydroxyapatite that is non-nano, so it's larger particles, but then it's not as effective. So you kind of take for me personally, the hydroxyapatite that's not nanoparticles would be the one I would go to, because I'm not eating lots of sugar. I don't really actually need any remineralization agent.
Right.
So,
and is that commercial? Is that available? Like you can just
commercially available. There's a few things you want to look at.
Non-nano. It's actually
Well, I
designated.
I don't want to just say don't get nano hydroxyapatite, because while there are concerns, it can be just fine. I'm just not fully sold on that. It's just totally benign yet.
Yeah.
But when it comes to nano, there are rod shape and needle shape, and you don't want the needle shape because so there's a lot that goes into just picking this out. I can actually provide some like brand recommendations if people are interested in that. But I mean, I like to just go rewind a little bit and say, okay, we can find the best toothpaste for you, whatever. But from my perspective, like me, that's why I don't really care about remineralization agents very much, because like I'm not demineralizing my teeth all day long.
Right.
So diet plays the role.
Now that the topic came up and came out a bit here, I'm just really curious, and I know it can be a very lengthy discussion, but your take on fluoride. I mean, I know we shouldn't be using mouthwashes, mouth rinses. We want our microbiome to not have a antibacterial wash going over it. But the whole thing with fluoride, I really refuse at my pediatric dentist. I don't know, hope I'm not wrong in doing this, but I refuse the fluoride treatments for my kids. And, I always got the stink eye when I did, but tell me the lowdown on that.
I am right on board with you. So my biggest concerns with fluoride is with developing children. An adult that is using fluoridated toothpaste and spitting it out, there are some risk there, but it's like pales in comparison to young children drinking fluoridated water day in and day out, doing high concentration fluoride varnishes, rinses, toothpaste, swallowing this. Because the research is, I mean, there is an ever-growing body of research showing how this fluoride consumption during development very negatively impacts the brain and is neurotoxic and is almost on par with lead as far as drops in IQ in children in many studies. 5 IQ points it seems to be almost like kind of like the baseline. And to me, the risk of getting some cavities, and we can talk about that as well, pales in comparison to like damaging a brain for lifelong. Like I could fix a cavity in a couple minutes. Like I can't fix that brain. So even the research, like one of the largest studies ever done with regard to this, showed that fluoridated water in particular might reduce the incidence of cavities by 1 surface cavity. Just to give you a perspective, there's a surface cavity on a pediatric tooth. I can literally fix that in like 5 minutes. So to me, it's not worth
the risk to the not irreplaceable brain tissue.
Exactly. And there's other risks. Thyroid risk with fluoride. It can compete with iodine for uptake in the thyroid, so it can lead to hypothyroidism. We see communities that have fluoridated water have higher rates of hypothyroidism, kidney issues, bone issues. So there are like actually a lot of potential concerns of overconsumption of fluoride for sure. The biggest one for me is just the pediatric brains that I feel like does not justify the risk for fluoride in developing children.
And the fact that it's typically in public water is
in the United States.
Horrible. It's horrible. Yeah.
70% of the United States, while most of Europe and really the rest of the world is not fluoridating the water. There's more fluoridated water consumption in the United States than the rest of the world combined.
Wonder why.
Yeah.
All right. Another topic that I'm always really eager to learn more about is the root canals, because of so much, and I want to say conflicting information. I feel like there's so much information out there about root canals and the damage that can be there for people who have had root canals. And I don't know if you could kind of give a little synopsis highlight on your opinion on that.
Yeah, it is a nuanced discussion, which is why I think you see such confliction, because someone's talking about this nuance over here, and kind of like the fluoride we were just talking about. If we could talk about another nuance where they'd be like, oh, it's totally fine, and more or less the research would support that. But then we look in the pediatric population, like, oh, this is very concerning. So with root canals, something that high level people don't tend to consider is if you don't get a root canal, you still have to do something. So you have to extract that tooth. That's the option. And so if you extract that tooth, what are you going to do? Are you just going to leave a hole? Because that actually has consequences as well. Teeth tend to shift, you change your bite. So if you change your bite, the way your teeth fit together, that can also, we just talked about, it could lead to recession. It's not the end of the world, but there are consequences to doing nothing as well if you lose a tooth. Probably the safest of all the routes would be that, okay, you take the tooth out and just, it is what it is. But a lot of times people don't want just a space. So are you going to get an implant? Are you going to get a bridge? Are you going to get a partial denture? Like, there's all these other treatments that you'd have to do that come with their own risk. And I think an implant's a good one. So a lot of times you're going to use a titanium implant. Almost all dentists are going to use titanium. There's some biologic dentists that will use ceramic, which is, I will say, more biocompatible, but very difficult to place, technique sensitive. Many people aren't candidates for it anyhow. So maybe I'm getting too much into the weeds, but you have to do something. And so there's also risk with implants. Probably you'll hear at least probably as many horror stories with implants as you have with root canals. An important thing with root canals is if you're getting a root canal, it needs to be done properly. Endodontists are specialists that do that. But if you get a root canal and it's not done like expertise, you can leave canals that are unfilled. And this is which can harbor bacteria and lead to chronic infection. And I think a lot of the problems that people experience with failed root canals is this, where perhaps the root canal would have been fine if it was placed differently. Okay, so it wasn't necessarily the gutta percha, the root canal material that was causing the problem. And it is strange that this is pretty much, I believe, the only organ that would die that we would leave in the body. Basically, if an organ dies, we take it out, right? So it is a concern, just leaving a dead tooth in there. But there's many people that have root canals that have lived long lives, and it didn't seem like that was negatively impacting them. So I'm not going to say broad spectrum, you got a root canal, get that tooth taken out tomorrow. But at the same time, I would do my best to avoid needing one. And that's why I like to try and I focus on the preventative, the education, and the nutrition part, because if you get that part right, you're not going to need root canals.
Yeah. And like so much of this stuff, there's so much information coming out, and, even on women explanting, having had breast implants and the sickness, disease, and illness from that, and they're explanting. And then, so let me segue on to amalgams, mercury fillings. That's something also that I just think that we should really pay attention to. And what's your opinion on that?
Absolutely. And I think there's a couple of very important things to consider. One is amalgam fillings, that's mercury, that is the concern. And before you just rush to go get all your mercury fillings drilled out, they need to be taken out properly, because often someone who's not being careful, you'll get more acute exposure from removing an amalgam than you would get the rest of your life leaving it in your mouth. So that is something to consider.
I know. So do you recommend? So I've been looking into just trying to find a holistic dentist in general to deal with my dental, but I don't know, I think I have one or two amalgams in there that I would like to have properly, appropriately, replaced with, I guess it's a composite material they use now.
Right. But you make a good point. You, just like everything in healthcare, you have to always consider the pros and cons, because you get the amalgam drilled out. Okay, well, let's assume they do it well, so you don't get acute mercury exposure, because then it's worse. You'd have been better off just leaving it in,
Right.
until it at least needs to be replaced or something. But then you're going to fill it with the composite material, and a lot of composite materials, they've gotten better, but tend to leak. You got BPA concerns. You got other concerns, is what I'm trying to say. There's like a lot of these, we like to think there's just a perfect solution.
What are we supposed to do, Kevin?
The best solution is nothing will compete with your natural teeth. Not an implant, not a denture.
Yeah, we should all go back to the day of birth and know what we know now, which is just to eat meat, seafood, eggs, and water, and live a healthy, happy life and have all our teeth.
It's why I do like to talk. I like to treat kids. I like to talk preventative. I like to do education, because sometimes I wish I had the golden answers for like, hey, just do this. So we're talking about what's the next best option for people when we're getting to these kind of discussions. And I recognize those are very important things to discuss, because like you said, we can't just go back and redo it. That said, worth mentioning, I have a tiny amalgam filling that I had since I was a kid, back when I ate a bad diet. Very well placed, and I've left it. I wouldn't get it taken out until I think there's a problem with it. So that's just my kind of perspective. If you have just one small one, it's well placed, and will I get some mercury vapors like throughout my life exposure? Yes, but I believe all toxicity comes down to the dose, the frequency, and the duration. And so when I consider the cost benefit ratio, and basically the risk benefit analysis, one small mercury filling, I don't think it's the end of the world.
Yeah, that's probably great advice. And if you could address this, what are your thoughts on prediabetes or diabetes being the possible cause of damage to small capillaries at the apex, leading to teeth to die and needing RCT?
It's interesting. I just don't think it's a main cause, in my experience, because most of the causes, like we can see what most of the causes is. There's this gigantic hole in the top of the tooth, and basically the bacteria ate their way through the tooth to the nerve known as the pulp, where there's also the vasculature and the nerve supply. And that when the bacteria gets to the pulp, the dental pulp, is when you need a root canal. It's when people are in pain, and basically so we can see that is what's causing them. Some teeth die due to trauma, and that again is a disruption mostly of the nerve and the blood and the vasculature. I'm not opposed to thinking that this is also a potential cause, where we get this microvascular damage that we see in other places because of prediabetes and diabetes. But as a major cause of root canals, I would be skeptical that it's a major cause.
So I have a group over in the chat saying that they wish they could evolve to get a third set of teeth in our 40s, and other people chiming in, yes, I'd love a third set.
Maybe one day we'll get this place where we can like just regrow a tooth. You put a little something in there and you regrow a tooth. I think there's research done in this area currently right now. I read something a week or two ago about, like they were just saying, a third set of teeth growing in a third set of teeth. I think it's a little ways off though.
Yeah. And here's a great question, because I know as a parent, and the pressure I would get in that pediatric desk office, oh, but your child had very deep crevices. So what's your opinion on this as a pediatric dentist?
My opinion is it would really be based on the parent. So for example, Lisa, if you had a kid and I knew like how you're feeding them, I'd be like, no, you don't need to seal it. Like, you're fine. Most kids, however, eat very, very bad diets. 60 to 70% of their diets, ultra processed foods, and sealants can help prevent cavities, which can help prevent root canals, and really for a lot of these kids losing their teeth. So the opinion is, do sealants help prevent like worse dental outcomes for a majority of the population? Probably is a good idea. However, if you are the parent and you're watching your kids diet and you're watching their oral hygiene, no, not everyone needs to get sealants. So that's kind of how I think about it.
Have you heard of this book?
Yes, fantastic book. Highly recommended as well. I like to talk about that book because I was reading it at the same time I was reading, I have it behind me somewhere, a massive academic kind of craniofacial development book. And this James Nestor book, which is a bestseller, which, I was kind of like, am I going to learn anything in this book? It's, kind of for a lay population, whatever. It was fantastic. And I got through this book so fast. The other book got put on hold. James Nestor is a fantastic writer. He tells good stories in it. And it talks a lot about the main issues of like, people think like everyone breathes, but most people are breathing wrong. So it's always just kind of eye opening how important it is to breathe properly as well.
And do you think that we've lost the ability naturally, instinctually to breathe properly because ultimately of our poor diets?
I think a lot has to do with the craniofacial development. And so the reason that we see this huge rise in malocclusion is because our mouths are not big enough. They're not as big as they should be. And it's not just our mouths then, it's our airways. And so then we have a hard time breathing through our nose. We combine that with, I don't know if he talks about this in breath, our modern environments where lots of allergies, kind of pollutants as well, which can lead to congestion. All of this kind of leading to mouth breathing, which is not what we want to be doing. We want to be breathing in and out of our nose most of the time. But I don't think like we are doomed. And if someone is a mouth breather, most people can train to be nasal breathers.
Yeah, and it seems that so many people are at least partially improving on their breathing issues by doing the mouth taping. It's really become a very popular trend for, I mean, I'm fortunate. I've always been told I sleep so silently
That's great.
and with my lips closed, so I've never taped my lips shut, but I know so many do and so many benefit from it. So
Yep. Fantastic way to
yeah.
train nasal breathing, especially when you're sleeping, because you don't have conscious control otherwise. Like when you're awake, you could set like an alarm, like, all right, I'm going to check 3 times a day to make sure my tongue's on my palate, my mouth closed, and I'm breathing through my nose. That little awareness, if you set a clock 3 times a day, it'll become second nature in a couple of weeks. But when you're sleeping, you can't do that.
Can't do that. Yeah. Well, thank you so much for joining in. I really appreciate it. This has been really a great conversation that I wanted to have with you. And I hope that I can have you back on another time and get more into the nitty gritty of a lot of these topics of the questions we have. But thank you so much all who've joined us live. And we will catch you next week. Thanks.
Thank you for having me on.
Thanks, Kevin. And please, if you could get me the link, any links that we spoke about so that I can like to the non-nano hydroxyapatite
Non-nano, I
remineralization.
can send you fluoride, links to the presentation, those 3.
Yeah,
If anything else,
that'd be great. Thanks so much. All right. Bye.